All right. Today we have Dr. John Lawrence, who you were one of the first people that I saw after my traumatic brain injury. And I owe so much to your wisdom, your uh, just the depth of
Good looks and
knowledge that you
charm.
have,
Good
your
looks and charm.
charm,
Good. Okay.
all the things,
Keep it
I
coming. Keep
know.
it coming. Come on.
But I mean, I really do. I mean, my immune system completely collapsed, and got on a plane and came to your incredible office in Sarasota, Florida. And so I just want to do some deep dive around traumatic brain injuries because there's a community of thousands of people right now that are looking for answers and professionals that can support them through their injuries. So, just first and foremost, can you share just a little bit about your expertise around brain injuries?
Well, I have suffered from a brain injury myself. It came from mold and Lyme. But I also I was a it's like I grew up in Hawaii, right?
Mhm.
And I remember like our street, it was Pond, it's called Pond Road. It's on Kaneohe Marine Air Station there in Oahu. And so it's kind of got these hills and stuff. And I was on my skateboard and a palm frond was in the middle of the road. My skateboard hit the palm frond and I fell and I hit my head so bad that I went blind for like, I think it was about 3 hours. And it was freaky, man. Remember my dad was freaking out. My mom was freaking out. I'm on the couch. I'm like, I can't see. I can't see. And then my eyesight came back, but I also just had so many different head traumas just as a kid and as a young adult, kite surfing and just life, right?
Yeah.
So I think a lot of times we learn more from our own personal experience because when you live it and you're in it yourself, you really get it at a much deeper level than just reading something in a textbook.
Right. So, share what do you think are one of the things that I think was so powerful about the work that you did with me specifically is that you combine, supplements and methylene blue. And, I fully believe that a lot of that inflammation that I was having and didn't even really understand what was happening to me because a lot of neurologists, even and doctors don't understand what's happening with some of these brain injuries. Can you speak a little bit to just your process with supplements as well and brain injuries?
Yes. So my background is in as a naturopath, and I've been practicing natural medicine for 30 years now. Wow, it's like time flies. And I'm also a chiropractic neurologist. So a lot of people don't really never really hear about chiropractors being neurologists, but in my field, you can specialize just like in the medical field. And so the training is quite extensive because I would offer it's much more difficult to work in the methods that we use as functional chiropractic neurologists because like, okay, think about this. The medical community generally uses pharmaceutical based programs, right? So you go to a neurologist, they're going to spend a lot of time imaging and all kinds of diagnostic testing, labs, whatever. And when they get the diagnosis, the thinking stops at that moment because all they do is they go into a book, they flip through the book, they enter the diagnosis, and then it tells them which drugs they should prescribe, you know, or surgeries or whatever. And so in my field, once we get the diagnosis, the thinking actually starts because then we're trying to figure out what's the root cause of that, right? And what types of things can we use to apply to fix the problem. And it's almost always rooted in some inflammatory response that's happening in the central nervous system and or structural issues that might be preventing proper fuel delivery to the brain, as well as metabolic waste, clearing waste products, because we're constantly making toxins They
Right.
call them endogenous toxins. So not only do we have exogenous toxins, which are toxins we take from our environment that get into our brain, but we also have toxins we make, and it's oxidation, right? We make
Yeah.
energy, we have oxidation, and if we don't clear these things, that can become a problem in and of itself. So, with that said, we put together comprehensive programs for our clients and our patients that include things that address the actual root cause and or fix the structural integrative because the brain wants to be integrated. Yeah,
Mm.
the brain wants to be able to be in balance, and it wants to be able to fire all these pathways appropriately to keep everything in balance. And we're constantly working to try and maintain this balance, both neurologically and chemically.
Yeah.
And chemistry is going to really dictate, think about the soup
Yeah.
of our chemistry, right? It's like the fluids, like what type of chemistry is in our fluids, and what kind of chemistry is in our brain? Does it favor us to make energy efficiently,
Yeah.
or does it cause us problems and become a headwind to our mitochondria?
Right. Well, you brought up a good point. I want to go back just for a minute because I've often wondered if, because I had COVID so severely, if when I actually got this brain injury, the disruption to my autonomic nervous system was so severe. And do you think that there's a correlation to that in the brain?
Yes, and the more and more information is coming out on spike protein. And so not only are we getting spike from having COVID, but also these spike proteins are incredibly inflammatory. So you had kind of a combination of stacking of, exposure to mold. There was some different viral titers that were high. It's okay. I'm just,
Yeah.
HIPAA's out, right? We're just
Yeah.
throwing
Go
it all
for
out
it.
there for the
Go
public
for it.
to see. Yeah, the curtain is open.
Yeah.
There's Patricia Damon. Um, yeah, so all of these things kind of stack and cause more and more challenges to us making energy efficiently.
Yeah. And I think that's what, some people who experience my injury was specific to transmagnetic cranial stimulation. And, one of the things that they're now kind of discovering is like when you have this magnetic frequency that you're nuking the brain with, and you already have a sensitive system. For me, I had an earlier traumatic brain injury as a child. And then all of a sudden, you start nuking this part of the brain. And then you combine it with some of these underlying viruses that haven't been reconciled. And I think like one of the approaches that I really appreciated with your care was this full comprehensive understanding of the patient. And so there's a lot of I mean, now I've met thousands of people with my injury desperate for healing. And so I'm just curious, like for these brain injuries, how do you really approach it? And will you talk a little bit about your diagnostic tools? Because I remember you saying, like, we've got to get you in here to do this diagnostic. And it's like you're driving drunk every day. That's how, I mean, that's the severity of the brain injury. And I think it's pretty profound what you can do there and the comprehensive approach to your healing modalities.
Yes, yes. So on the structural side, what we find is that when there's imbalances in the brain, it shows up with functional aspects of the eyes and the eye motion. And because there's all of the different areas of your brain, I mean, you've got frontal lobe, you've got parietal, temporal, you have the cerebellum, right?
Mhm.
And then there's the brainstem, and there's all these different pathways, and everything has um, an effect. And the eyes utilize almost all parts of the brain, so you can see the dysfunctional aspects of the brain through these tests that we do with the eyes. And this test is a computerized test, and it looks at pursuits, which is our eye following a target,
Mm,
Saccade, which is a fast eye movement where we should be accurate to moving. So when you see people, when their eye kind of goes fast, and it's normal if you're just sitting there having a conversation, you'll see people moving their eyes if they're following a target, or you'll see people's eyes moving quickly into different positions. Well, we can test that, and also your ability to hold your eyes on a fixed point for a period of time. That's called gaze fixation. And so what we do with that data is we can see if there's certain hemifields. In other words, there's different ranges of motion within the eyes that are more problematic than others. And then we have a special test that we do through kinesiological testing or muscle testing to determine if there's problems with the eyes in certain positions, with the head in certain positions. And then we release that. So there's a wrapping there's connective tissue wraps around the brain and spinal cord,
mm,
becomes the whites of the eyes. So you can imagine this happens throughout the entire body through the fascia. And
mm,
this is like these connective tissue, kind of thin sheets of connective tissue that wraps around all your muscles and around your nerves and around your brain and spinal cord. Well, when it's around the brain and spinal cord, they call that the
mm.
dura mater, which means tough mother. And that dura mater gets, did you have a tough mother?
Yes.
I ask that when I see people when they have a lot of restrictions with their dura mater. And
Yeah.
it's interesting that there's a lot of also psychological and emotional components that kind of tie into this as well that can be released when we release the
Yeah.
adhesions. But that's basically what we're doing is we're releasing adhesions to allow not only the eyes to have a return to their functional motion, which really helps to ground people and to reestablish where we are in space as it relates to our environment, which is really,
Hmm.
really important. And it also regulates our autonomic nervous system. But there's also something that happens with this connective tissue is it can have a negative impact in something called cranial rhythm, which is a motion that the cranium has. And as we start to learn more about something called the glymphatic system, which is the gutter system, and it's almost like kind of a defrag that happens every night, right?
Yeah.
Primarily with deep sleep, where the brain goes into this glymphatic protocol. And
Wow.
if that's not working properly, then we don't detox our brain.
Yeah.
So
And
we
I
see a
think
lot
one
of,
of the things that you did for me is after TMS, I had damage to my right ocular nerve and also my hearing. And two of the modalities that you kind of honed in is doing those eye exercises, right? And then the other aspect was you were using laser on my ears to really help reconstitute the hearing that I had lost. And so those were really powerful. I wanted to ask you just quickly, with this injury and, the toxic load and all of that, like, what is the first line of defense to kind of, target, inflammation in the brain and that dysregulation to the autonomic nervous system. Because one of the things that we did as well were balloons. Is that related to the sheath that you're talking about in the brain as well?
yes, it's important to really fully assess, with traumatic brain injuries, we go through an assessment where we're looking at a variety of different markers, and then we put together, like you said, it's more comprehensive because we want um, the milieu, like this is like the you think about the terrain is another word, right? It's like we think about all of the tissues and the chemistry within the tissues really matter as far as disease, dyshyphonesia, a lack of ease in the body.
Mm-hmm.
And so we have genetics and then we have epigenetics, right? So some people have certain genes that aren't working as well as others. And those genes can be expressed dysfunctionally when we have a lot of toxicity or infections. So
Mm,
if we have that present, we want to have something within the treatment plan that addresses that. And also with you, we also had some structural issues that were
Mm,
affecting some of the ocular, and they call it the vestibular ocular reflex. So there's a conversation between the eyes, the neck muscles, the head and the head position, and all of the spinal muscles. And it goes from the inner ears to the eyes to all our postural muscles, which
mm,
is highly sensitive and yoked to the autonomic nervous system.
mm,
And for some people that might be listening to this and hearing this for the first time, there's two parts to your nervous system. There's the autonomic nervous system is the part of the nervous system that it regulates your heart, your digestion, your blood vessels and your circulation, your respiratory system. Very, very sensitive systems that keep us feeling good, and we don't think about them because they're autonomic, right?
mm.
They're automatic. And so this autonomic nervous system is challenged with a lot of people after brain injuries, and that needs to be addressed first. If you don't fix the autonomics, then the body, you can't have proper fuel delivery to heal, right?
Right.
So that's always a really important aspect of our treatment plan.
Well, I think what's interesting about that as well is that even you correlating, and it's the first time I've made the connection, is that after my brain injury, I had these massive neck pain, and then it was digestion issues, all these other issues because the whole body is impacted. And so it's like, this is just one part of it, but this is like the mothership of controlling it. So share with, I think something that's really been alarming with this group is they feel like they're never going to heal, that healing isn't possible. And I wonder if you can speak a little bit about brain injuries and the possible, I mean, they need hope that healing is possible. And can you just share a little bit about neuroplasticity and the brain's ability to heal?
Yes, really, really good question. And this is really the a really common fear. So if you are one of those people and you're kind of thinking, oh, yes, that's me. I don't think this will ever go away. I got to live with this the rest of my life. And that is a very common fear that happens when we get sick, right? Or we have disease is, oh my gosh, this is never going to go away, right?
Mhm.
So you're normal. That's common. Everybody goes through that process. And to your point, there is an ability of the brain and the nervous system to basically bounce back. They're finding out more and more that even up into adult life, that there are a lot of aspects to our central nervous system, our brain, that allow us to relearn things and to kind of rewire itself. And that's, as you mentioned, it's neuroplasticity. So plastic, they use the word plastic because you can take a piece of plastic and shape it into whatever you want to shape it, and then you can change the shape of it.
Mm,
And this is kind of alluding to this ability of the brain to relearn and rewire itself. And this is what, so you think about like an adult versus a baby. A baby
mm,
has, and a young child has a lot more neurons, right? And we
mhm,
lose neurons as we get older. And so you look at like an older person that might even be in their 80s, and they're much more efficient. They've got intelligence way beyond what a child would have. So our intelligence and our functionality is not tied to the amount of neurons that we have, but it's more tied to its ability to rewire itself. And that's what's different between a child and an adult is this neuroplasticity that's occurred where things are wired in very specific ways
mm.
to provide for a variety of different high level functionality. So you never want to lose hope. The brain is a very malleable heal area of the body that can heal itself.
Yeah. So, where, in your opinion, do psychedelics come in and brain injuries? Is it something that you believe is a powerful tool on healing? And also, you touched on something that I think is really important for this group as well, and that's mindset, right? And the fear that's coming up, and how intertwined do you think people's healing is to their thoughts and emotional landscape?
Well, as you know, I've had a pretty significant healing journey in the last 8 months myself. I got injured my leg and my thigh. It was back when we had hurricanes, and during the course of the hurricanes, I had a slip and fall and wound up in the hospital and had to get a surgical procedure on my leg called a fasciotomy for a condition called compartment syndrome. And I was mismanaged in the hospital, and they denied me treatments that I think probably would have saved my leg. But fast forward 6.5, 7 months, I wound up actually having to get my leg amputated below the knee. And so I've gone through a lot of emotions as it relates to the loss of a leg and going through a lot of pain and discomfort and challenges with my own health. And I've discovered that one of the keys to moving through this is to allow the feelings of the sadness and the loss and the fear to actually sit with those things. And if you are constantly avoiding it, you're constantly in your mind every time it goes to something that's uncomfortable, you're pulling away from that. No, I don't want to feel that way, and you're avoiding it, and you're trying to do a lot of things to avoid it, watching a lot of TV and movies or being on your phone and social media. I would invite you to just maybe be curious about it and sit with it, maybe even do some breath work prior or some meditation. Psychedelic journeys can be really helpful in this sense, where you just really own it and let it happen. Don't fight it.
Mm.
It's the one who faces the dragon gets the gold, right?
Yeah, I appreciate you bringing this up so much because after my injury, I was stuck in so much anger because it took me out of the game, right? Overnight, having a thriving practice to being completely bedridden. And so, will you speak a little bit more for those when you say just sit with the emotion? A lot of people who have these brain injuries, they're like, they don't even know how to be in a different state of mind than in
Mhm.
this paralysis of overwhelm. And when you're that dysregulated from a brain injury, how do you sit in the discomfort? Can you speak to that a little bit more?
Yeah, well, a week or two ago, I was getting ready in the morning and I just felt just this overwhelming feeling of sadness came up with me. And, at the time I was kind of getting ready to go to the gym and do a workout. And instead of just pushing through it, I don't have time for that. I basically got in my chair and I sat there and I just let whatever that was come, and I used just a curious mind, right? Like, what is that? Like, and the idea to make it bigger, right? Like, what am I really afraid of? If you have something that you're afraid of, being curious about it and really thinking like, what is it that I'm afraid of? Where do you feel it in the body? You can kind of use these different sensations, like what does it have a color? Does it have a texture? Does it have an odor? Trying to get clear about what exactly that is, and that's all you need to do. You don't need to fix it.
Mm,
At this level, all we're doing is we're just being curious,
mm,
being curious about what it is. And what a lot of people will find is that by simply doing that and allowing this to happen, that pain and that fear, if that's what it is, will really dissolve, and you'll find yourself on the other side of it feeling happy and lighter, and
mm.
you might even feel some bliss.
Yeah,
That means that you've successfully allowed yourself to go there.
yeah.
So, and I would say, don't be afraid to go there. Don't live there.
Yeah, that's such a good point. You're like the godfather of methylene blue. You have a book that just came out, if you'll tell people about that as well, so they can pick that up and really understand it. But what role does that play in inflammation in the body?
Yeah, well, you'd also asked me about psychedelics, which we
Mm,
should go back and talk about.
yeah.
Methylene blue, it's a brilliant blue salt, and it was um, um, one of the first cures to malaria, and it's literally the meta. It's a this medicine has it's been around before the FDA even was a thing, and so it's shown an incredible amount of safety and efficacy on a variety of different health conditions because it has all these different effects in the body that allows it to be a medicine for infections, a variety of infections, depression, helps with mood. It helps with the body's inflammation. They found that it actually helps to clear up some of those protein tangles, like in Alzheimer's, you have beta amyloid, like in Parkinson's, you have alpha-synuclein. In traumatic brain injury, kind of the global word is tau protein,
Mm,
concussion and TBI. So these are protein that accumulate in the brain, and methylene blue has been shown to kind of dissolve those and help clear them out. It's been shown to help with spike protein
mm,
and some of that inflammatory. And then one of the most incredible things that it does is it enhances our ability to make energy with the mitochondria. And when we have excessive energy or when we run really low with energy, this is where disease has its ability to fester because we don't have the energy to adapt to stressors.
mm,
Those stressors then can activate certain inflammatory processes in our cells that dampen its ability to make energy through the mitochondria.
mm.
So methylene blue works and it enhances the energy output of the mitochondria on average about 30%.
Wow. And is it safe for anyone to take? So anyone who's watching this, can they order, from your lab and can anyone begin taking it? Or is there tests that people need to take? How
There's
can
yeah,
they access it?
there's a couple things to consider with methylene blue. One is you want to be somewhere around 1 to 2 milligrams per kilogram of body weight, and this is actually considered a low dose.
Mm,
Uh, and when you start getting into the higher doses, there's some concerns to take it along with SSRIs.
mm,
So you either want to be working with someone that understands it and can help coach you through the process. Where we do offer health coaching services as well through our clinic. Um, but there's a gene pathway called G6, and if you have this, then that can also be problematic with along with methylene blue.
mm.
Uh, but yeah, I mean, it's extremely safe if you're like kind of below that 2 milligrams per kilogram of body weight. The challenges that have been seen in with methylene blue have been with mostly intravenous administration of methylene blue in the higher doses were above 2 milligrams and more so above 4 milligrams per kilogram of body weight. And so like you think about like the average, adult human being is between 50 and 70 kilograms. So that's going to put things around, you know, um, anywhere from 100 to 150, 200 milligrams. Um, when you start getting up above like the 3 and 4, 500 milligrams, then that's where you might have to be a little bit more cautious.
Yeah. And so is it something that they would take every day? Do you take time off, like 5 days on, 2 days off? What's the recommendation there?
Yeah, it's good to take breaks. Everybody's a little different in how they metabolize and their body utilizes methylene blue. So it's one of those things that's good to experiment with to see
Mm,
how you do with lower dose versus kind of work your dose up a little higher. And then
mm,
also some people really need to take more frequent breaks from it because it can build up with some people.
yeah.
As a general rule, I recommend 10 days on and a couple of days off.
Mm, okay. So let's go back and talk about psychedelics and brain injuries. Do you have a favored psychedelic as it relates to brain injuries? And what do you think the intersection and the role is between the two?
Yeah, so the three psychedelic medicines that I am um, fairly studied up on that really help with the brain recovering are psilocybin, LSD, and ketamine.
Mm,
And all three of those really work on the central nervous system in very unique ways.
mhm,
Um, Psilocybin and LSD really work on connecting more parts of the brain, right? So allowing us to have more access to parts of the brain that we would not normally have access to.
mm,
And the psilocybin really works on the creative aspect. And so oftentimes when people are looking to solve certain problems and they might be kind of stuck in a rut where they're looking at the problem in a certain way. And in order to solve problems, if we can look at these problems in different perspectives and different ways, we can start to kind of get creative with different ideas, right? And
mm,
so LSD is really powerful to allow both halves of the brain to work
mhm.
together and to integrate, and also multiple areas of the brain to
Yeah.
be enrolled in tasks.
Mm,
And then ketamine is really interesting because ketamine really works on BDNF and neuroplasticity and really enhances learning,
mm,
with administration. Now, methylene blue actually has a place in this whole mix too, because methylene blue helps with something called memory consolidation.
mm.
So if we were to use a psychedelic and we were to get some great insight, it would be then up to the individual to integrate that experience to lock the short-term memory into the long-term memory banks.
Yeah.
And methylene blue has been shown to really enhance that memory consolidation. So it can be a really nice blend between the two.
Yeah, one of the things that you supported me with in your clinic was actually exploring doing ketamine. And I was nervous about it initially because of the brain injury. You feel so disoriented. And I believe between methylene blue, your melatonin, and doing ketamine, and then all the other interventions that we did there as well, and really supporting my immune system, all of a sudden I started coming back to life. It's been a journey. It's definitely been a slower journey than I would like. If I could come plug into your clinic for just months on end, I'm sure it could be exponentially um, quickened, but I think some of these interventions absolutely helped me turn the corner. And that's why I'm so excited to share with this community. Like, there's hope. There's actually, providers that are working with this specifically. And I think circling back to your point, when I first started working with a neurologist, all they want to do is put you on meds, which isn't healing the brain, it's just masking the symptoms. And that's something that you're just so deeply skilled in. Um, just to kind of wrap things up, is there anything else that you would share with someone trying to tackle healing a brain injury like this?
Yeah, sleep is incredibly important. We talked about the lymphatic system, but I would offer sleep is more important than diet and exercise.
Wow.
Fasting, I think, can be a really great tool for people to detox the body. And one of the ketosis, or like a ketogenic diet, is worth trying, I think, for a lot of people because ketones are a more efficient fuel source for the brain. Do you think about, I actually just did a post on this on my Instagram account, but we have different rhythms that our body goes into, like the sleep wake cycle. With sleep, we just pointed out, but also there's um, this rhythm where it's feast and famine. And when we're famining, or we're fasting, we go into ketosis, but we also clear different cellular components that become dysfunctional, and we need to clear old and recycle them into new constantly. And if this isn't happening, then this can also be a huge problem for people with neurological conditions. So besides looking at enhancing more ketone and getting more metabolically flexible, that comes with doing intermittent and long-term fasting protocols. But you can also even get exogenous ketones, like Ketone Aid, the company that makes some different ketone products, and they've got this drink called snake water. And I've been enjoying drinking those drinks. And you can find these on Amazon. But exogenous ketones can be helpful to take anytime, because when you throw ketones into your diet as a supplement, the brain can use those ketones. But when you fast, you're going to make them on your own, and you're going to primarily make it from breaking down your own fat. And those that creates building blocks that make ketones. And then that's why when you fast, at first you feel like shit.
Yeah.
And after a day or two, all of a sudden you feel great. Like people are like,
Yeah.
oh my gosh, clear. I've got lots of energy. And what's really happening is that they're all of a sudden producing a lot of ketones. And then these ketones are anti-inflammatory and they really help with brain health.
Yeah, I love that you brought that up. There's been a couple uh, gentlemen who were injured by this treatment, and one of their biggest things to recovery has been fasting. I think one person went over a month and was finally able to start reversing some of this brain injury. So, I mean, being able to hear it from you as well just, solidifies the power of that.
Yes.
Um, I can't wait. Where can people find you?
Have you ever heard of cerebrolysin?
No.
Okay, we've been using a lot of that. It's administered intravenously, and
Mm.
it's Russian, and basically they take because pigs basically have a very, very similar genetic makeup as humans. And so there's this thing and the Germans have done a lot of research on it too, where they take pigs and they slaughter them. And while the various organs are totally fresh, they cut them into tiny little pieces and put them into sterile water. And what happens is the components within the cells go out into the liquid and then they filter it. And then so they can take the components of different cellular structures in an injectable solution. And so you can do this with the thymus gland and with the brain and with the pancreas and the kidneys and the liver and placenta. And, there's all these different, some people will call it live cell. Um, but it's not stem cell, but it has this really powerful effect. But basically, cerebrolysin is this technology from pig brains. And there's a really large body of research on this for brain injuries. And we do quite a bit of that here at the clinic where we're doing it as an IV along with all the other things that we're doing. But this is something that some healthcare practitioners would offer that in their clinic, but not all. But
Yeah.
there's definitely some that are aware of it.
Wow. Wild. It's crazy where we're going. Well, thank you so much. I appreciate you taking so much time. I'm so excited to get this information to this group and see what's possible. So where can they find you? What's the name of your clinic?
So our clinic is Advanced Rejuvenation, and our website's advancedrejuvenation.us.
Mm.
And I'm on Instagram. It's at Dr. John Lawrence, and Lawrence is Lieurance. And then, of course, I'm very uh, involved with scientific advisory with Mitozen Scientific.
Mhm.
So mitozen.com.
And that's where they can order some of these supplements as well, right?
The methylene blue, high dose melatonin, yeah, all
Yeah.
those fun things. We have a fasting kit, Fast Track Fast,
Oh,
where
wow.
we have some things that really help to accentuate some of these effects through fasting.
Mm. Thank you. We're
Yes,
sending you so much love, and I can't wait to have a lot of people find you and actually get some support. So,
my pleasure, Patricia.